Humanity has yearned for immortality to avoid the icy grip of death. Spanish explorer and conquistador Ponce de Leon searched Florida in 1513 for the Fountain of Youth, whose waters restored the youth of anyone who drank or bathed in it. Literary Knights of the Round Table searched for the Holy Grail, which had miraculous healing properties and granted eternal youth to whosoever drank from it. Vampires of lore gained immortality, but at a cost. According to the news, the quest for immortality, or at least a longer lifespan, may be closer than we realize. In December 2023, the FDA stated that a drug to extend the life of large and giant dogs has a reasonable expectation of effectiveness. The drug will now be tested in bigger trials with the hope of formal approval by 2026. In this video, we will examine what occurs during aging. How do we treat the symptoms of aging? What are emerging treatments to slow or reverse aging? And then finally, should we try to extend the life of humans? Stick around to the end of this video when we ask the question, should we develop anti-aging drugs to increase longevity? One of the most visible signs of aging is the changes that occur to our skin. Sun and ultraviolet light exposure over a lifetime cause an accumulation of effects that damage the skin. This, combined with the natural process of aging, results in a breakdown of collagen and elastin fibers in the skin, contributing to a loss of elasticity. The amounts of hyaluronic acid that draws water into the skin also decreases, which contributes to wrinkling. There are different options for treating aged skin, including lotions, hormone replacement therapy, and more invasive procedures such as Botox, fillers, or even plastic surgery. When we are young, our arteries can expand and recoil as the heart pumps blood through our bodies. As we age, materials build up along the inside of our blood vessels, which can partially or even completely block blood flow. The arterial walls also stiffen, which requires a higher blood pressure in order for the heart to push the blood through our bodies. Protecting our blood vessels from the effect of aging involves reducing risk factors such as high cholesterol, remaining active, and, if necessary, surgical procedures such as angioplasty to open up blocked blood vessels. Within our bodies, changes to our heart with aging can contribute to a limitation of health. Our heart valves gradually become calcified, so don't work as effectively. Scar tissue in the form of fibrosis interferes with heart contraction, and changes to our blood vessels can cause hypertrophy or growth of the heart muscles of the left ventricle as greater pressure is required to push the blood throughout the body. Maintaining a healthy heart during aging involves eating a healthy diet, remaining active, and having a healthy weight. If problems arise, medications can regulate blood pressure, lower cholesterol levels, and regulate blood sugar. Aging also affects our bones, which can limit our ability to remain active. Throughout our lives, our bones are continually being replaced through a process where old bone is removed and replaced with new bone. With aging, this process slows down so that bone breakdown occurs faster than bone deposition. Similarly, our joints are covered with cartilage that allows our bones to move smoothly at joints. As we age, the cartilage breaks down, resulting in damage to the cartilage, and pain, swelling, and stiffness of joints. Like the other symptoms of aging, the skeletal effects can be reduced through maintaining a healthy, active lifestyle. However, when problems occur that may be treated with medications, physical therapy, or in severe cases, surgical intervention such as joint replacement. Overall, the symptoms of aging can be reduced through maintaining a healthy, active lifestyle, which includes regular exercise, getting enough sleep, good diet, and reducing stress and staying positive. There is extensive, ongoing research on ways to slow or reverse the effects of aging. Research on stem cells showed that these cells can be collected from a patient and then used to replace aged or damaged cells with healthier cells, thereby reversing some of the symptoms of aging. Gene therapy is also being researched as a method to control cellular processes that are disrupting during aging. such as neovascular age-related macular degeneration and diabetic retinopathy. The gene therapy can turn off the activity that contributes to disease or turn on proteins that support treatment of the disease. So returning back to that article that talked about an effort to extend the lives of dogs, what we can see is that domesticated dogs come in a wide variety of breeds with diverse sizes, builds, and appearance. However, they're all descended from gray wolves, so the differences that we see are the result of generations of selective breeding for specific traits. This has caused an inverse relationship between the size of the dog and the lifespan, with smaller dogs living much longer than larger dogs. IGF-1, more formally known as insulin-like growth factor 1, is a hormone that works with other hormones to regulate growth of bones and tissues. There's a delicate balance caused by an optimal level of IGF-1 in the body. Too low a level can contribute to factors of frailty, as seen in aging individuals, such as cardiovascular disease, osteoporosis, and sarcopenia, a condition that is associated with a reduction of muscle mass. Too high a level of IGF-1 can also contribute to cardiovascular disease, as well as the diseases of type 2 diabetes and cancer. The experimental drug that is being looked at to extend the life of large dogs reduces the high levels of IGF-1 in large dogs to levels that are more similar to what is observed in medium-sized dogs. Recently, scholars have raised the question as to whether or not Ponce de Leon really searched for the fountain of youth. Similarly, attempts to identify a single factor to extend lifespan may be difficult, since the body is under the complex control of multiple hormones and proteins. Still, these efforts may continue to improve the health and quality of life of aging individuals. But should we try to extend the life of humans? Prior to around 1900, the average life expectancy was around 25 to 30 years. While there were some people much older than this average, the high infant mortality rate dramatically reduced the life expectancy. The average human life expectancy has increased rapidly over the last 150 years. This rise is associated with improvements in public health, such as clean water, sanitation, improved medical care, such as antibiotics and vaccines, as well as neonatal health care, as well as improved standards of living associated with economic growth and improved nutrition. However, this extension to the human lifespan is adding about 1 billion people to the world's population every 12 to 14 years since 1960. And we reached 8 billion people on planet Earth in mid-November 2022. This growth of the world's population is not sustainable, as large numbers of people lack access to clean water and sanitation. There's an inequitable distribution of resources, including food. There's widespread poverty. And many people live in regions that are adversely affected by climate change. So with this background, we reach our ethical dilemma in science for this week. Should we develop anti-aging drugs to increase longevity? Should we try to extend the life of beloved pets? Should we try to extend the life of agricultural animals such as stud horses? And then finally, should we try to apply this technology to extending the lives of humans? Thank you for viewing this week's Ethical Dilemma in Science. Please see the description below for additional information and references. You can leave a comment below with your thoughts on this topic or suggestions for future topics. If you enjoyed this video, please like it and subscribe for more discussions on the ethics and the impact of science on society. Until next time, stay curious and be informed.